This is Dr. Del Grosso from SF Chiropractic, and I want to talk to you today about something a little bit different. Not really different, but something we don't think about a lot of times when we talk about going to the chiropractor, because everybody thinks, oh, well, my back hurts, your neck hurts, and you have to be injured. And the truth is you don't. And especially as you get older, it wasn't that long ago that the average lifespan was about 57 years old. Well, today, people are living to probably a ripe old age of about 78 years old on the average. And they say by the year 2020, a lot of people are probably going to be living to be over 100 years old. That's awesome. And a lot of it's because of technology, advances in medicine, a lot of different things. The downside to that is we really haven't changed our quality of life a whole lot, or the things we do a lot. And remember, look at it this way. If you're 65 years old and you've lost, we call it functional mobility, about 75% of your functional mobility, which is typical today, and you live to be 85, that's 20 years that you live that you don't really get to do a lot of things, that you've lost a lot of your quality of life. And it doesn't have to be that way. And that's what I want to talk about is as we get older, you peak with your functional, your spinal, which is primarily the biggest part of your functional mobility is spinal mobility. We peak at about 29 years old, and from there it starts to regress. It doesn't have to as fast as it does. Typically by 60, 65 years old, we've lost about 75% of our functional mobility. I'm telling you that if you do the right things, if diet, exercise, chiropractic care, spinal maintenance and stuff, you can probably maintain about 75% of your functional mobility up to about 70, 75 years old, which means you're a lot more active, you do a lot more things, and you maintain that quality of life, since we are living a lot longer, okay? It's easy to do. It's not hard. Okay, it's just dealing with structure, it's dealing with the muscles, it's dealing with good symmetry, good balance, and just maintaining that mobility, maintaining that spinal movement. Remember, your spine is the framework for everything. It's the structure. It's what everything's based around. And as we lose that mobility, we start to lose all the other mobilities and all the other good function as well. Let's kind of sidetrack and talk to a little bit. One of the main muscles there is your multifidus muscle. Okay, multifidus is a stabilizer muscle of the spine. It runs up along the spine. Okay, and if there's weakness there, you have instability. You don't have that good stabilization. You have problems with the curves. You can have problems with some of the mobility. The opposite side, if it goes into spasm and contract, you can have a lot of problems with spinal mobility and just that restriction, being locked up like that. And there's some real simple things you can do to work on that. We can help you with it. We can help you strengthen it. As far as stretching it, there's things you can do at home. Okay, any kind of extension type exercise with the spine, in a chair, cut low, leaning back, arching back. Guess what? You're working your stretch and multifidus. You get down on your stomach, lay on your stomach, lift your left hand, your left arm, and your right foot up. Okay, hold it for about 10 seconds, then put it down, lift your right arm and your left foot up, then switch from side to side. Hold each one 10 seconds, another good way. If you don't feel comfortable lying on your stomach, then you can get on your hands and knees and do the same thing. Get down on all fours and lift your left arm, your right leg up, hold it about 10 seconds, bring it down, do the other side, same thing. Do that 3 or 4 times. Another good way. Another thing that's good for multifidus, both to strengthen and stretch, is what I like to call cat back. Okay, and that's where you get down on all fours, you arch your back up like a cat does, and then you go ahead and relax it and let it sway back down. You hold each one for about 10 seconds. Again, excellent way to both stretch and strengthen those the multifidus muscles, or those stabilizer muscles. All right, I want you to start doing that after you watch this today. Start doing it now, and then get into the office. Let's talk a little bit about wellness. Remember, you don't have to have a problem to take care. It's a lot easier to prevent a problem than it is to treat one. Okay, and preventive maintenance care is the key, especially as we get older. All right, so get in, make an appointment, let's talk about it. We'll get you in. It's easy. If you get on a good program, you come in once every month or two, just to maintain things. We'll give you stretch, we'll give you exercise, we'll talk about your diet a little bit, and we'll make sure that, you have a good quality of life well into your 70s. Thank you, and have a great day.